If I told you that the real danger for many people over 60 isn't the vaccines themselves, but the confusion, fear, and half-truths surrounding them, would you believe me? I've had countless patients walk into my clinic terrified, convinced that certain vaccines are secretly harming seniors, while others assume every shot offered is automatically safe for everyone. The truth is far more nuanced, and as a physician and as a son, I can tell you this with absolute honesty. It's not about blindly accepting or blindly rejecting vaccines after 60. It's about understanding which ones are appropriate, when they are appropriate, and under what conditions they may not be. Today, I'm going to walk you through 5 vaccines that often raise concerns in people over 60, not to create fear, but to give you clarity. Because when it comes to your parents or even yourself, clarity is power. Let's begin with the flu vaccine. Every year I see seniors debating whether they should skip it because they never get sick or because they heard it weakens the immune system. Influenza can be especially dangerous after 60 because the immune response naturally declines with age. Complications like pneumonia, hospitalization, and even heart strain are far more common in older adults. However, what many people don't realize is that not all flu vaccines are identical. There are high-dose versions designed specifically for older immune systems. The key isn't avoiding the flu shot altogether, it's ensuring the right formulation is used and that it's timed appropriately, especially if someone is acutely ill or has had a severe allergic reaction in the past. As a doctor, I would never let my parents skip a potentially life-saving preventive tool out of fear, but I also wouldn't let them take it without reviewing their full medical history. Now let's talk about the shingles vaccine. Shingles risk rises sharply after 50, and the pain can be devastating, sometimes lingering for months or years in a condition called post-herpetic neuralgia. The newer recombinant shingles vaccine is not a live vaccine, which makes it safer for many older adults, including some with weakened immune systems. However, timing matters. If someone is undergoing chemotherapy, taking high-dose steroids, or dealing with a severe autoimmune flare, vaccination may need to be delayed. I've seen patients rush into getting vaccinated during periods of intense immune suppression, not realizing that their body may not mount an adequate response. It's not about refusing the shingles vaccine, it's about strategic timing. Pneumococcal vaccines are another important conversation after 60. Pneumonia is one of the leading causes of hospitalization in seniors. Vaccination significantly reduces severe disease risk. But here's where confusion often arises. There are different pneumococcal vaccine types, and the recommended schedule has evolved over time. Some people think they need multiple doses spaced in specific ways. Others think they've already had a pneumonia shot years ago and assume they're covered for life. As a physician, I review records carefully before recommending another dose. Over-vaccination isn't usually dangerous, but unnecessary medical interventions should always be avoided. Proper spacing and confirmation of prior immunization history are essential. Then there's the tetanus, diphtheria, and pertussis booster, often given as Tdap or TD. Many adults over 60 assume this is only for children or younger adults. In reality, immunity to tetanus wanes over time, and pertussis can still pose a risk, particularly if seniors spend time around grandchildren. However, I always assess individual risk factors. If someone has had a severe neurological reaction to a previous dose, that changes the conversation. Medicine is never one size fits all. Blanket statements like everyone over 60 must get this, or no one over 60 should get that, ignore the complexity of human health. COVID-19 vaccines also sparked intense debate, especially among older adults. The data consistently showed that seniors face the highest risk from severe infection, hospitalization, and death. Vaccination significantly reduced those outcomes. But even here, nuance exists. Booster timing, recent infection status, underlying cardiac conditions, and current medications all influence decision-making. As a son, I would never make a health decision for my parents based on headlines or social media posts. I would sit down with their physician, review their blood pressure control, diabetes status, kidney function, and immune history before deciding on timing. The bigger issue is not the vaccine itself, it's whether the person receiving it is medically stable at the time. One of the most dangerous misconceptions I encounter is the belief that vaccines overload the immune system in older adults. In reality, the aging immune system is more likely to underreact than overreact. Immunosenescence means the body may not respond as robustly, which is precisely why certain vaccines are formulated differently for seniors. On the other hand, there are real contraindications that must be respected. Severe allergic reactions to prior doses, known anaphylaxis to vaccine components, and certain acute illnesses warrant caution. This is why individualized care is critical. I also want to address something rarely discussed: polypharmacy. Many people over 60 are on multiple medications for blood pressure, cholesterol, diabetes, arthritis, or heart rhythm issues. While most vaccines do not significantly interact with medications, overall health stability matters. If someone is in the middle of a cardiac event evaluation, recovering from surgery, or battling uncontrolled autoimmune disease, that may not be the ideal moment for vaccination. Timing and clinical judgment matter more than fear-based avoidance. Another factor that influences vaccine decisions after 60 is frailty. Frailty is not simply age, it's a measurable decline in strength, endurance, and physiological function. In extremely frail individuals, the benefits and risks of any medical intervention must be weighed carefully. However, frailty often increases vulnerability to infections, which means preventive measures become even more important. The conversation should focus on risk-benefit balance, not emotional reactions. I've also seen patients decline vaccines because of misinformation about ingredients. The reality is that vaccine components are present in extremely small, regulated quantities, and safety monitoring systems are robust. That said, transparency is vital. If my parents had questions about ingredients or side effects, I would want their doctor to answer them clearly, not dismiss their concerns. Trust is built through honest discussion, not blind reassurance. Let's talk about side effects, because this is another area where fear spreads quickly. After 60, people may experience soreness at the injection site, mild fever, fatigue, or muscle aches. These are signs of immune activation, not harm. Serious adverse events are rare, but they are monitored carefully. The important thing is recognizing red flags, such as persistent high fever, severe allergic symptoms, or unusual neurological changes, and seeking medical attention promptly. Preparation matters too. Staying hydrated, avoiding scheduling vaccines during periods of acute stress or illness, and spacing multiple vaccines if necessary can make the experience smoother. I often advise patients not to receive several new vaccines all at once, unless there's a clear medical reason. Spacing them can make it easier to attribute side effects and reduce anxiety. Now, let's address the emotional side of this topic. Many adult children feel pressure to protect their parents by either pushing vaccines aggressively or forbidding them entirely. Both extremes remove autonomy. As a son, my role would be to ensure my parents have accurate information and access to a physician who understands their history. I wouldn't make decisions out of fear. I wouldn't refuse preventive care based on viral videos. And I wouldn't consent to a medical intervention without reviewing contraindications. Medicine is a partnership. It's also important to understand that recommendations evolve as research advances. What was advised 10 years ago may not be identical to today's guidance. That doesn't mean doctors were lying. It means science refines itself over time. Seniors deserve updated, evidence-based care tailored to their current health status. Another common myth is that if someone has lived to 60 or 70 without certain vaccines, they don't need them now. Longevity doesn't eliminate risk. In fact, age increases susceptibility to complications from infections that younger adults might brush off. The goal of vaccination after 60 is not to make someone invincible, it's to reduce the likelihood of severe outcomes. At the same time, I want to emphasize that lifestyle still matters enormously. No vaccine replaces good nutrition, regular physical activity, adequate sleep, blood sugar control, and stress management. A strong foundation improves immune response. Vaccines are one tool in a larger health strategy, not a standalone solution. If I had to summarize my position as both a physician and a son, it would be this: I would never let my parents reject a recommended vaccine out of misinformation, and I would never let them receive one without thoughtful evaluation. I would insist on reviewing their allergies, medications, immune conditions, and recent illnesses. I would make sure the timing was appropriate, and I would ensure the benefits clearly outweighed any potential risks. That is responsible medicine. Blanket fear helps no one. Blind compliance helps no one. Individualized decision-making helps everyone. So before you decide that certain vaccines are dangerous after 60 or assume they are automatically mandatory, pause. Ask questions, review medical history, understand the purpose of each vaccine. recognize true contraindications versus internet myths, and involve a qualified healthcare professional who knows the patient personally. In the end, protecting our parents or ourselves means staying informed, balanced, and proactive. The most important takeaway is this: age alone does not make vaccines unsafe, and skepticism alone does not make someone informed. Thoughtful, evidence-based conversations do. If you found this information valuable, make sure to subscribe to the channel, like this video, and let me know in the comments what topic you want to see next.